Have you ever been sick or know someone who was sick and they could not afford the medications to treat a long-term condition? One long-term diagnosis is high blood pressure. High blood pressure is a common and manageable disease, but left untreated, it could lead to a stroke, a heart attack, or even death. This is just one example of a common but treatable condition. And being able to afford the medications needed to treat this condition should not be a worry that people must face, but sadly it is. Making medications affordable leads to better medication compliance, lowers the need for emergency visits to the hospital, and improves overall quality of life. Now, who doesn't want to live a healthier life? I know I do. That includes making choices such as taking the medications that have been prescribed to you to help control a chronic illness a person may have. Now, it is difficult to be compliant if you cannot afford to purchase the medication. In a recent study, the Kaiser Family Foundation found that 1 out of 4 Americans taking prescription drugs either skip a dose or take no medication at all. Unfortunately, that means that the person is not receiving adequate dosing of medication or receiving no medication. And this is to treat the condition. According to the Government Accountability Office, the United States spends more money than any other country on prescription drugs. Now, this is an issue that must be fought on a large government scale. And on December 9th, 2021, North Carolina's 6th District Congresswoman Kathy Manning and Georgia Senator Reverend Warnock introduced the Capping Prescription Cost Act bill to legislation. And this is to save families and individuals money on their medications and prescription costs. Capping the cost of medications will not only help the condition, but also to help lower the need for emergency room visits to the hospital. If a person cannot afford medication, it's highly likely that they are not able to afford regular maintenance to visit the doctor. This leaves the person vulnerable to symptoms of the condition going untreated, and usually requires a visit to the emergency room to treat those symptoms. According to the American Journal of Emergency Medicine, utilization of emergency departments in the United States steadily increased by 14.8% from 2004 to 2014. And anyone who has ever been to the emergency room can agree that the number of people waiting in to be seen can be large, the wait times can be long, and frankly, no one really wants to be there. But waiting there makes you get the treatment that you need. And this will ensure the condition and you get the prescriptions that are needed. Up to 2/3 of patients who present to the ED are discharged with a prescription for short-term symptom control. Capping the cost of prescription medications will not only help lower the need for emergency visits, but also help to improve the overall quality of life for people. According to the World Health Organization, or WHO, quality of life is defined as an individual's perception of their position in life in the context of culture and value systems in which they live and in relation to their goals, expectations, standards, and concerns. So in other words, it's how you view your health, your finances, and your happiness. Every person deserves a good quality of life, and being able to afford medications is a part of that. Quality of life should be the focus of policymakers, with the understanding that capping the cost of medications to make them more affordable will allow a person to manage their condition and benefit from a healthy life. In conclusion, capping medication costs for prescriptions leads to better medication compliance, lowers the need for emergency room visits, and helps improve the quality of life for people. So, if you or anyone that you know are in this situation, I ask you to learn about your local senators, congressmen, and congresswomen, and support their fight. Support by voting. Talk with your doctor and let them know your financial situation, and hopefully they can help with obtaining your medications at a lower rate through pharmacy assistance programs. And lastly, know that someone is out there and hears you. You just never stop making your needs known. Thank you.